Good afternoon, everyone, and welcome to today's presentation on understanding Medicare. My name is Howard Pressman. I'm one of the financial planners and a partner here at EBW, and I appreciate you taking your time to spend it with us this afternoon. I know this is a confusing and popular topic. We have a lot of folks joining us today, and again, thank you all very much. We are fortunate to have with us this afternoon Danny Cohen from John Hancock Investment. I've known Danny for quite some time. He's a good guy, and we're looking forward to him sharing some Medicare secrets with us. But Danny is a senior business consultant for John Hancock Investments. He consults with independent financial advisors such as us in Delaware, Maryland, and Northern Virginia. And is responsible for marketing of John Hancock mutual funds, ETFs, 401ks, and 529s. He works with advisors in branding and marketing their practices, in addition to other investment advice and solutions. He's been with Hancock for 18 years and has been in the financial investment industry for 22 years. He's married and has 2 kids, and I know I think he lives in Rockville. So without further ado, I'm going to turn this over to Danny.
Sure thing. Thank you, Howard, and thank you to everybody at Egan Berger and Weiner. Thank you all for joining today. I know many of you are just probably settling into lunch, or you're at work and had a break. I very much appreciate the fact that you took the time to be here to talk about Medicare. So I know many of you have a lot of questions around this topic, and as we all know, it's a complicated topic. It's got a lot of moving parts to it. So some of this might feel like I'm spitting water out of a fire hose at you today, but I'll try to take it slow and make it so it's simple for everybody to understand. And as you can see,
Danny.
Yeah, sure.
Sorry, I didn't mean to cut you off. The one thing I did forget to mention is we do have the Q&A feature enabled for today's presentation. So if you hover your mouse over the bottom of the screen, you'll see a black bar that should scroll up from the bottom, and there is a box with Q&A. So if you have any questions, we will leave time at the end of today's presentation to cover them. So go ahead and enter them in the Q&A. We'll make sure you get answers. So sorry about that, Danny, but I wanted to make sure I pointed that out.
No, it was good that you did, actually. We'll take the questions at the end. A lot of the questions I possibly could answer during the course of the presentation. So yes, by all means, feel free to put some questions in the chat and we'll take them at the end. So as I mentioned, Medicare can be a complicated topic, and sometimes it feels like you're trying to drink the water from a fire hose here, but I think I'll try to make it a lot easier for you today just to get a sense of how this works. So just before your 65th birthday, some of you may have experienced this, you will get inundated with letters in the mail from insurance agents or insurance agencies trying to sell you some type of insurance plan because they know that you're turning 65. And you're probably going to look somewhat like these people here, where you're going to be sitting with a pile of papers in your hand, staring at all this paperwork, wondering what's going on when it comes to Medicare. And it does beg this question, is this how understanding Medicare makes you feel? Yes, it's confusing. There isn't necessarily one place to go to really find out how it works. And I think today's topics will really shed some light on that. So we'll talk about the history of Medicare, the Medicare parts and when to enroll, the Medicare costs, Medigap plans, which are also known as supplemental plans. You'll hear that term used a lot. Medicare Advantage plans. And then lastly, I know a lot of you are still working past 65 and have a lot of questions around Medicare and how that works, and we'll address that here today. So let's talk about the history of Medicare. Many people don't necessarily know when it started. And Medicare was signed into law back in July of 1965 by President Lyndon Johnson. And keep in mind, back at that time, prior to 1965, there really wasn't a good national health care program for people when they retired from work. And obviously that caused a lot of problems for seniors. You had over 50% of people age 65 or older who didn't actually have in-hospital coverage And that caused over 8 million seniors to be living in poverty. So the passing of this law obviously was a huge landmark event. And you'll notice that President Truman and his wife Bess were actually the first two recipients here of Medicare Card 1 and 2. And the reason for that is when President Truman was in office, he was a big proponent of a national health care plan, but many of his proposals were defeated. But he was such a big proponent that finally when President Lyndon Johnson got into office, they actually were able to get Medicare signed into law. So President Lyndon Johnson felt that Truman and his wife should be the first two recipients, given that he was such a big proponent of it. So when it first was signed in, 19 million beneficiaries initially enrolled. Today you have over 61 million people signed up in Medicare, and that includes Medicare Advantage plans as well. And they say by 2029, it'll account for 18% of the federal budget. So you can definitely see how this changed things forever for seniors. So let's now talk about the parts of Medicare. And this is usually where it gets confusing for people. So just so you know, there's 4 parts. There's Part A, there's Part B, there's Part C, and Part D, which we'll talk about here. So Part A is what you know as your hospital coverage. That is your room and board, as you can see here when you go into the hospital. And for most people that have worked over the course of their lifetime, this part, as far as the premiums are concerned, are free. So that's what you're paying into your FICA taxes, along with your Social Security. When you look at your pay stub, you'll see that FICA tax, and that 1.45% that you see going out is actually going to Part A. So for most people, this is free, and we'll talk more about that as far as the premium is concerned. The second part of it is what you know as Part B, where it gets complicated for people, and then they wonder whether they should take it if they're still working. But this is your outpatient coverage. As you can see here, this is, doctor visits, preventative care, outpatient services, physical therapy. And what's important to note here is Part B covers 100% of preventative care and 80% of all other outpatient care. So kind of give you an example of preventative care. That would be for a lot of vaccines like COVID-19 vaccine or a flu shot. That would be covered at 100% because that's preventative. Or if you needed a mammogram or a colonoscopy or a diabetic screening or a bone mass measurement, these are all preventative type of surgeries. So these things would be covered, and that's what's important to know about Part B. As far as what's 80%, a lot of people ask the question, well, knee replacement, as an example, would be covered at 80%, but that's an outpatient surgery, so you'd have to pay 20% of that. Physical therapy is a good example of something that's an outpatient surgery or an outpatient thing that you would go to, and thereby it's not covered at 100%. So if you had cataract surgery, that's an example where Medicare would pay 80% and you'd be on the hook for 20, or if you had glaucoma. So if it's medically necessary, they'll cover it. A lot of people have questions around that, and you want to make sure that you know that it's medically necessary, and your doctor obviously has got to code it correctly. These two parts make up what you know as original Medicare. That's Part A and Part B. And these are the only two parts that you actually get from the federal government. These parts were basically modeled after the 1960 Blue Cross Blue Shield plans. Back then, those plans had an in-hospital coverage, but they also had an outpatient part to it as well. And that's really how Medicare was modeled. And that's why you see these two parts today. Part C, which is where it gets complicated for people, because Part C isn't something necessarily that you need. I kind of refer to it as the travel agency of healthcare, meaning you can get all of these different parts A, B, C, and D on their own, a la carte. What Part C does, it's almost like me saying to you, hey, listen, would you like to get your flight, your car rental, and your hotel when you go on vacation from one place? And that's that analogy that you would say would be the travel agent on Part C. Many people can buy these things on your own, as you know, a la carte. But Part C was signed back into law in 1997 by President Clinton, and it's where you can get all these parts in one. A lot of people like that, and there's a lot of reasons why, and we'll cover that as we go forward. Part D is what you know as the voluntary drug program. A lot of people get this through work because they have what's known as credible coverage. Even though they say it's voluntary, you do need it or you could incur a penalty. But this is known as your pharmacy card. This is typically when you walk into a pharmacy, what you would use for medication. A lot of people need this. For instance, if you get cancer or you have medication that's outpatient, it wouldn't be covered because you're not taking that medication unless you're in a hospital. So anytime you walk into a pharmacy, the Part D drug program would help. And that's where you get this either on your initial enrollment period or in the fall enrollment period between October 15th and December 7th. Now, people ask, okay, how do you enroll in Original Medicare? So typically you would do it through the Social Security website, and you can see that here. You enroll in Part A and Part B through the Social Security website. Some people who work for the railway companies would do it through Railroad Retirement Board. And it's typically, if you do it on Social Security, about a 10-15 minute process when you hit about 65. And then people do ask the question, well, what if I'm already taking Social Security benefits prior to 65? What happens is you're automatically enrolled, and then about 4 to 6 weeks just before you turn 65, you'll automatically get that card in the mail. If you sign up right at 65 and you're not taking Social Security benefits, you'll get it a few weeks after you sign up. But that doesn't mean you're enrolled yet. So just to kind of give you a sense of how this all works, the initial enrollment period here, this 7-month window, is the most important thing you want to be thinking about just before you get to 65. And how it works is it begins 3 months before your birthday month. It includes your 65th birthday month, and then it's 3 months after your birthday month. And that's how they get that 7 months. So that's your initial enrollment period. You can see that in our nice little calendar chart here. And we gave you an example, and I can tell you, I didn't make this up today. This is just coincidental, that if you turn 65 today, May 20th is your birthday, your initial enrollment period would start February 1st and run through August 31st. How it works is it starts from the beginning of your birthday month, which would be May 1st, and then goes back 3 months. So most people want to know, okay, well, depending on when you enroll, we'll see when you will start actually with Medicare and when it will become effective. So if you enroll in those 3 months prior to your birthday month, Medicare will start on the first day of the month, the 65th birthday, which you heard me say May 1st. Where it gets a little tricky is that if you were born on May 1st, meaning the first of the month, you actually would start and be eligible on April 1st. People born on the first of the month, it goes back a month prior. And that means you would go 3 months back from April 1st. So your initial enrollment period would be January, February, and March. And then you would start, as I said, on April 1st, even though your birthday is May 1st. If you delay it, and you'll see here at the bottom, Medicare will start obviously delayed. So if you file in your birthday month, meaning you did it here in May, you would typically start in June. And then if you file a month later in June, you would start in July. And then if you file in July, you go 2 months after. So that's how it works as far as being delayed. People who miss this initial enrollment period and they're not working for a bigger company where they didn't realize they had to enroll, there is a general enrollment period, and that's from January to March 31st. The only problem with that is that even though if you sign up at that time frame, your Medicare does not go live until July 1st. So just keep that in mind. All right, so let's talk about the cost sharing of Medicare. So think about it as paying a premium to start. For instance, I work for John Hancock, as you all know. We're a big company, and we have a big medical insurance plan. So what happens is every 2 weeks from my pay stub, I have to pay the premium for the health plan, and that, you know, is the cost of the insurance. But when I actually use the medical services, then I have to pay co-pays, co-insurance, and possibly a deductible, and that's known as cost sharing. So when you look at Part A, for most people it's free, But there are out-of-pocket expenses, and a lot of people don't necessarily realize this. So there's a lot of writing here, but I'm going to take you through this and give you some thoughts around some of these comments. So in order for Part A to cost nothing, if you've worked and paid into your FICA taxes for at least 40 quarters, which is 10 years, then Part A is free when you get there as far as the premium is concerned. So a lot of people ask the question, well, what if I work 9 years and 6 months? Can I go back to work part-time to earn those extra 2 credits I need for the 40 quarters? The answer is yes, and a lot of people ask this question about Social Security. So the same thing that makes you eligible for Social Security makes you eligible for Medicare. And then you'll see if you've paid in, you're considered paid up, so Part A will cost you 0. So sometimes people ask, well, what if I didn't work the 40 quarters? I worked 30 to 39 quarters, and I'm not going back to part-time to work. What's it going to cost me for Part A? So 30 to 39 quarters, you would pay $259 a month to get Part A in 2021. And then if you worked less than 30 quarters, it would cost you $471 for Part A. So that just gives you a sense. Now, a lot of you are probably thinking as I'm saying this, can I qualify under a spouse's work history? And the answer is yes. You'll see that here. You have to have been married at least a year, and your spouse must be eligible for Social Security benefits. So just something to think about here. If you're 65 and you want to go on Medicare, but you're married to somebody who's 61, they're not eligible just yet for Social Security. So at 65, you would have to buy Part A for 1 year until that spouse that you want to take the Medicare off turns 62. So that's an important factor if you've kind of got that age gap in the marriage. And then some of you who may be divorced want to know how this works. Okay, you can see you qualify under a divorced spouse's work history if married at least 10 years, and the spouse is eligible for Social Security and you're single. That's the same rule as Social Security. Excuse me, you can apply, you can qualify for Medicare, but that's the same rule that applies for Social Security. And then lastly, if you're widowed and were married at least 9 years before your spouse died, if you're single, you'll qualify. But if you're married after 60, you can still get Medicare benefits in the survivor situation. All right, so Part B and Part D work a little bit different, and this is where it gets a little tricky for people on understanding the premiums. So Part B and Part D, you pay monthly premiums. And some people like to avoid paying these premiums, especially if they're working past full retirement, and we'll talk about that. But how this works is monthly premiums is the base premium is $148.50 a month that you pay for 2021 for new enrollees. And if you're already collecting Social Security, that would be deducted from your Social Security check. If you're not taking Social Security, then you'll be billed quarterly. Sometimes people get a bill for 3 months. I've heard stories where they get a bill for 5 months, but it's typically quarterly. And if you want to set up a monthly situation, you can go on Medicare's website and set up an Easy Pay account, which will allow you to take that money out once a month if that helps. And then you'll see at the bottom here, IRMA for high income earners. So IRMA stands for Income Related Monthly Adjustment Amount, and it came into law in 2007. And I can tell you that a lot of people were not happy about this, and some of you maybe on this call might be experiencing this now, whereas if you earn more than $88,000 individually or 176 joint, there's now a sliding scale where you'll have to pay more for Part B and D, and it's based off your modified adjusted gross income on your tax return. So what it looks like is this. And a lot of people find this out the hard way because they may have made an election to take Part A at 65, but they're still working and they delayed it. And then they think, okay, I'm 68, 69, I'm going to retire. And they never planned in the thought of what Medicare might cost a month, and they may have an IRMA. So how this works is Medicare and Social Security take a look 2 years back on your tax return. So in 2021, for Part B premium and D, they'll go back to your 2019 tax return and look at the modified adjusted gross income. So if you're 63 and you sold an investment property and you had a big cap gain with that, you're going to pay an IRMA on that. Or if you're 68 and you did a Roth conversion for whatever the reason, or you took a massive taxable distribution from your IRA, that's going to be included when they take a look. So typically what people do is they look to file an appeal, a request for reconsideration. And normally what Social Security and Medicare are looking for is some type of disruption in your income, meaning you retired. Is there a work stoppage? Is there a divorce? Is there a death? Some type of life-changing event is typically where you will win this appeal. It does not hurt to file the appeal. You would go on Social Security's website and you would print out form SSA-44, SSA-44, and you would file that appeal. You can file as many appeals as you want, and then you would just wait to hear from Social Security and Medicare to hear what they would say about that. Sometimes you would need to file more than one appeal because one year you had a massive tax gain and then you went quiet for a few years, you inherited some money, you then took a distribution from an IRA, and now all of a sudden, 3 years later, you need to file another one. So that could happen in your situation. But Medicare and Social Security basically recalculate your income every year in December, and that's how they know whether there's going to be an IRMA, and they'll reach out to you through a letter letting you know. I'm sure some of you have received this, and it wasn't a pleasant thing because you can see down here, if you're showing income of $330,000 versus maybe what you're making now, you would have to pay $475.20 a month for premium Part B. So this is a big reason why you hear people wanting to delay this. But like I said, you can file an appeal and there is a good chance that you may win it with a work stoppage. They're looking for a loss of income, not for a gain of income. If you get a gain of income, it's more than likely you won't win the appeal, but it doesn't hurt to file one. So in the case of the Part D premiums, you buy this from a private insurance company and the cost of it would range from $7 to $205 a month, depending on the plan that you have. The average is $40 a month. And then you still have this IRMA situation, and this came into law back in 2011. It was a part of the Affordable Care Act, where now you have to pay an IRMA as well on Part D. Now, if you don't enroll, they said it's voluntary. If you don't have credible coverage at a work or a big company that you work at, you will pay a penalty if you don't actually sign up for Part D, and that penalty is 1% a month. So just think of it this way. If you didn't sign up for 5 years and then you went to get Part D with no other proof of credible coverage, that would be a 60% penalty forever. So these are things you definitely want to pay attention to when it comes to Medicare. And you'll see here the IRMA works the same way with the income thresholds where they look 2 years back. The dollar amount is not the same as you can see here on the right. But if you win the appeal on Part B, you win the appeal on Part D. They're one and the same. All right, so let's talk about the cost sharing now because we talked about the premiums for A, B, and D. And this is usually where people get a little bit of a surprise because they don't necessarily understand the Part A cost sharing because everybody thinks, hey, I thought it was free for Part A. Thereby, I thought Medicare was actually free, and the answer is it's actually not, as you're finding out here. So the first thing, if you just own Medicare, the first thing that you're going to find out is that if you have an in-hospital stay, you're going to have a deductible of $1,484 right off the bat. And that's in the first 60 days. And then you'll see beyond 60 days what the co-pays are here. And then you get between 60 and 150 day what is known as, the one-time 60 days that you get, and then you're out of those days. So that's over the course of your lifetime, you get those extra 60 days. A lot of people like to buy extra insurance to be covered beyond that, and we'll talk about that here in a minute. But you'll see the first 3 pints of blood you have to pay for, and then $185 a day for co-insurance for skilled nursing beyond day 20. So they pay for the first 20 days, Medicare does. But a lot of people look at long-term care here, and that's because if you have to go to a nursing facility or you have a longer stay, home health care, you're going to need long-term care. And that's probably why many people at Egan Berger and Weiner have probably spoken to you at some point about long-term care. So long-term care has nothing to do with this part of the cost sharing. So just so you understand this, let's say we go into the hospital on May 1st, and you're in the hospital for 30 days, and you come out on June 1st, but then you go back in on June 15th. The good news is that you will not have to pay that $1,484 deductible because you're within that 60-day period. If you go into the hospital on May 1st, you come out on June 1st, and then you go back in on October 15th, that's beyond that 60-day period where now you're going to have to pay that $1,484 again, and it starts all over again. So that's something that people don't necessarily realize, and it's something you want to make sure that you're aware of. Now, the Part B part is a little different than Part A. So you're responsible for the $203 Part B deductible right off the bat. And remember, that's for each of you if you're married, right? It's for husband and wife or spouses. You're each going to pay that $203. And then Medicare pays 80%. So Medicare in this case would be primary. And then you pay the other 20% co-insurance. So where this becomes a problem is, let's say you get cancer or you have dialysis, where you have kidney failure. Yes, Medicare will pay 80% of that chemotherapy, but you're on the hook for the other 20% of dialysis or chemotherapy. And this is really what bothers people about original Medicare. It creates this scary thought that, okay, I'm going to have to pay the other 20%. And this is where I may want to be thinking about covering the gaps. And that's what we're going to talk about now. So you have two ways really to cover the gaps, and it's through the private market plan option. And there's two ways. The first way is what you know as Medicare supplement or Medigap plans, which mean the same thing. You hear somebody say supplement, it means Medigap. And I refer to that as the Cadillac service in Medicare, where you pretty much have everything covered. And I'll show you that here in a minute. But it's higher premiums, but there's really a lot less cost sharing. It's more predictable as to what you're going to pay, and it's mostly going to be covered when you have them covering the other 20%. The second way is what you know as a Medicare Advantage plan. Many of you have probably noticed as you're watching football or your favorite TV show in the fall, Joe Namath comes on TV trying to sell you on some kind of Medicare Advantage plan. So those typically have lower premiums. Sometimes they're zero premiums, but there is some higher cost sharing, and that's more modeled after kind of what Medicare looks. But they're very good plans. A lot of people like them. They're a little bit more cost effective. So let's talk about Medicare supplements in more detail. So what happens with the Medigap plan, as I mentioned to you, Medicare is the primary here. So what happens is the Medigap plan actually acts as a wraparound Medicare, and they pick up the other 20% that Medicare doesn't pay for. So they'll handle those deductibles on Part A, co-pays, and co-insurance, and you'll almost have nothing to pay if you're on that Medigap plan. A lot of people like it because you're not required to get a primary care physician. You don't need to get a referral for a specialist. And a lot of those plans actually are an exact set of benefits, so the benefits don't change year to year. It's really more the price. So you can see any provider really who accepts Medicare. You got to make sure that the doctor accepts Medicare, because if the doctor doesn't accept Medicare, the Medigap company will not pay the bill. And then you can use your Medigap policy to travel. People love Medigap for traveling. So I know we have some snowbirds on the call. So if you like spending 5 months in Northern Virginia or Maryland, and then all of a sudden now you want to go down to Florida, Medigap travels with you and is very good for that. So many different insurance companies offer Medigap plans here locally. I will tell you there is no difference in price if you go directly to an insurance agent who specializes in medical insurance, or if you go directly to an Aetna or Blue Cross Blue Shield. You will not pay more going directly with one carrier versus working with an insurance agent. It's the same price. So when you look at the Medigap plans or the Medicare supplement plans, there's 10 plans. They were standardized in 1990. And most people today are on Plan G and N, but many people who actually qualified before January 1st, 2020, meaning they turned 65 prior to January 1st, 2020, you're still grandfathered into Plan F. And as you look down the benefits here, that scary stuff I showed you on Medicare Part A, cost sharing and deductible, that's all going to be covered here by Plan F, G, and N. So feel good in knowing you also get 365 extra reserve days that if you had a hospital stay beyond 60 days, they're going to cover you. Now, what you'll notice here is that the Part B deductible, the $203 that I mentioned to you, is covered under Plan F. And Congress got together and said, hey, listen, we don't really like the fact that we're paying for Part B deductible that Medigap companies are playing, because we want to avoid people going to the doctor for every sniffle and cough. So in order to make sure that they could ensure that, they decided as of January 1, 2020, that they would require basically the applicant to pay for the Part B deductible. So you'll see here in Plan G, which is the most popular now, it really has all the same benefits that you see in Plan F, but you'll notice that the Part B deductible of $203 is not covered. So you'd still have to pay that yourself. A lot of people like the fact that there is emergency foreign travel. So keep in mind with Medicare, Medicare is good anywhere throughout the United States, assuming that the doctor takes it, and 93% of the carriers take it. But what if you want to travel outside the country? Medicare only covers you in 3 instances. So those of you who are on a cruise to Alaska and are going through Canada, they'll cover you there. Or for those of you who live on the border of Mexico and Canada, which is, I don't think most of us on the call here, if the closest hospital to you is in another country, they'll pay for it. And then in the case of Medicare, if you're within 6 hours of shore on a cruise, they'll cover it as well. So a lot of people like these Medigap plans because you get an extra $50,000 of coverage for foreign travel, where the Medigap company will pay 80% of the coverage and you'll pay 20%. So that's a big selling point as well to Medigap plans. And you'll notice as you go to Plan N, the Part B deductible is not covered, obviously, but then you'll notice Part B excess charges are not covered. So yes, this plan is going to be a little bit less than G. And what we mean by the excess charges is that, let's say that you go to the doctor and that doctor doesn't necessarily accept the assigned rates from Medicare. They can upcharge you on that bill up to 15%. So typically what would happen is if you were in Plan N, you'd go into the doctor's office and pay a $20 copay. You would pay $50, let's say, for an ER visit, but you would also be susceptible to those excess charges if the doctor does not accept those rates. But pretty much everything else is there. And this is pretty much what you would see in all the plans. So nobody's going to be able to change these no matter where you buy the Medigap policy from. All right, so just some things to think about on the premiums. The Medigap companies set their own rates. So as I mentioned, insurance agents or brokers can't change them. So it wouldn't matter if you went directly to an insurance agent to get a Medigap plan or you went directly to, let's say, Blue Cross Blue Shield. Now, I said the benefits don't change, but how they figure it out, the prices can change from year to year, and how they figure it out is on your age, your zip code, your gender, your tobacco use, and the eligibility for family discount. There is a family discount. It's not huge, but there is one. And as you can see, the rates are a little bit lower here in Oklahoma and Iowa. And I'm sure you're not surprised that one of the highest rates would be in Florida because there's so many retirees living there now. So when you put this all together and you kind of just wrap around and make it a little bit easier for everybody, this is what it's going to look like. So remember, when you get a Medigap policy, you still need to pay premium for Part A if it's not free, but for most people it is. And you need to pay for Part B. And then you get the Medigap plan, and then you also need a standalone Part D drug program because Medigap does not have that drug coverage. So what it would cost you here, Part A is $0 because you paid in, as most people, as I said, have over the course of their lifetime through the FICA. you'd see that base premium, assuming you're not subject to the IRMA of $148.50, and then the Part D average drug program, let's say, is $40. And then you'll see Plan G here says approximately $120. So this was figured out as if you were in Texas. If you were looking at a plan in Fairfax, Virginia, as an example, it's somewhere in the range of $105 and $140 as far as what a Medigap plan would cost. And as I said, this is really the Cadillac service, and this is where most people want to be, so most everything is covered for them. So if you do the math, you're looking at about $319 a month here in Northern Virginia. Keep in mind that's for each of you. Each spouse has to pay that separately, so a lot of people didn't necessarily assume this to be in the cost. Sometimes you might have a spouse that's, on your employee benefits healthcare plan, and you're paying a fortune. So some people, when they turn 65, what happens is their spouse leaves that healthcare plan from the big company, and they want to go directly onto Medicare because it's going to cost a lot less. So that's something to be thinking about. All right, so once you have this Medicare, original Medicare, and your Part B is effective, you need to know about how to qualify for Medigap, what your eligibility is for no health questions to get into a Medigap plan. So there is an open enrollment one-time window, and this is a very big thing to remember today. And as I said, it starts when your Part B is effective for Medicare. You get a 6-month window where you have no health questions. So when you turn 65, if you already retired and you don't have any other credible healthcare coverage, let's say at a company, you're going to get that 6-month window as soon as you turn 65 and it's effective, where you have no health questions. So it wouldn't matter, God forbid you had cancer or some kind of chronic illness, they have to take you. And then you'll see here, if you're working, let's say, for a small company, and we'll talk more about this later, where it's less than 20 people, and you already have Medicare Part A and B because you filed at 65 for it, when you retire, let's say at 68, and you work for this small company, you will get a guaranteed issue period where you'll have this 63-day window to get into a Medigap plan with no health questions. So a lot of people feel good in knowing if you work for a big company or a small company and you've delayed enrollment into B and D, you will get that window of opportunity to get Part B and D, but you'll also get that opportunity for a Medigap plan as well. Now, if you missed all of this, they're going to look at a 2 to 5 year health history on you as to what questions they will ask you. So a lot of people want to know, well, what if I had cancer 3 years ago, I'm healthy now, will they accept me? And typically what they're looking for in a Medigap policy is they want to see that you're cancer-free for 2 years, or you may be a diabetic and maybe on a small amount of insulin. That doesn't mean that they wouldn't accept you. So that's something feel good in knowing. There doesn't necessarily mean if you have one of these illnesses that you wouldn't be accepted by the Medigap company. Keep in mind that if you move and you already have Medigap, it will travel with you. So you don't go get a new Medigap plan if you have one, if you move out of Virginia or Maryland and decide to move down to Florida. You keep your Medigap plan. You may pay higher rates, but you do keep it. All right, so the open enrollment period is a little bit different for these states. In New York, you have open enrollment every day, so that's going to be a more costly plan, but you can get in with no health questions. And then in California, not that anybody here lives in California, but it's usually on your birthday month, just to kind of give you a sense that it's different in other places. All right, so Medicare misstep number 1, confusing the Medigap open enrollment period with the fall annual election period. A lot of people get this wrong. So Medigap open enrollment is when I said that one time where you get Medicare Part B being effective, and then you get this 6-month window of when you can get into a Medigap plan and not have any health questions. And that doesn't matter. That'll happen when you're 65, or if you're working past 65, as I mentioned, for a bigger company and you've delayed it, you will get that window again. Sometimes you'll get people on disability who now are collecting Social Security disability, let's say at 60. They've got to wait 24 months before they can get Medicare. But once they turn 65, they have another open enrollment window where they can get into a Medigap plan with no health questions. So that's key to know. The annual election period, I said, is from October 15th to December 7th. That's when you actually can choose to get into a Part D drug program if you missed it or you want to change it from your initial enrollment period of time. But it's also when you can get into a Medicare Advantage plan if you missed that open enrollment or guaranteed issue period when you retire from work. You typically get 2 months from when you separate from work to get into a Medicare Advantage plan, and we'll talk about that a little bit later. But you can't use the Medigap during the annual election period. So keep in mind, they're totally separate, and that's typically when you see the Joe Namath commercials coming on is in this time frame, or any other commercials for that matter. It's when they want to try to get you into a Part D drug program or a Medicare Advantage plan. All right, I think we're doing well. So people ask, well, why can't I get into a Medigap plan, after the fact? And it's no different than when you have homeowners insurance. If your house is on fire, the insurance company's not going to let you get insurance after it's on fire. And it works the same way with Medicare. If you get sick, they're not going to necessarily take you on because obviously it's a big cost to them. It works the same way. So just in summary, things you want to know. Before you go see the doctor with a Medigap policy is you want to call the doctor's office right away and just say, hey, do you accept original Medicare? Because if they don't accept original Medicare, Medigap will not pay the bill that's left over. And then you'll see as Medigap pays after Medicare, Medicare is still primary in this case. They pay 80% of the bill. And then what happens is the Medicare will send the bill directly to your Medigap company and they'll coordinate to pay the remaining 20% that's left over. As I mentioned to you, the plans are standardized, they don't change. And then they're guaranteed renewable, meaning so if you get sick while you're on this, they still have to renew you. And I said the benefits don't change, but the prices do. And then in the case of Medigap, you will need to add a standalone drug plan because there is not one in the Medigap policy, and that pays for your outpatient. So standalone Part D drug plan, typically what would happen is you would get that original Medicare, Part A and Part B. You would then get a Medigap policy, and then you would add a Part D drug program. And you would do that during the initial enrollment period that I mentioned to you during your 7th month window at 65, or you would have 2 months after you retire from a bigger company to get that as well. So you must be enrolled in Part A or Part B to be eligible for D, and you must live in the plan area. So people ask, well, what if I move from Virginia down to Florida? Do I need to get a new Part D drug program? Yes, you do. And we'll talk a little bit more about Part D. So there's 4 stages to it. And just so your head doesn't spin off, I'll focus here on one, which is the Part D deductible. So the deductible this year was set by Medicare at $445 maximum. Some insurance companies can charge less, but no more. And typically when you would walk into the pharmacy and you would get your medication, you might notice that you're on the hook for the first $445, and that is your deductible. So just keep that in mind, and then you'll see the other stages here, and we'll cover that here in the next slide. So this is where it gets a little complicated for D, but how it works is you pay for medications depending on which stage of the drug plan you're in and which tier. So there's 5 tiers, and let's just assume you're past deductible and now you're in the initial coverage phase. You'll see there that the initial coverage phase, you pay copay and coinsurance based on the drug tier up to $41.30. So up to that amount, you pay the copay and coinsurance, and then what happens is the next stage is known as the coverage gap, and that's the amount between $41.30 and $65.50. You're on the hook here for 25% of that cost. I do have some good news here. This used to be 100%. So when you referred to the donut hole to people in Part D drug plan, people would shake like a leaf because they assumed that they would have to pay 100% of the money between $41.30 and $65.50. The good news is that a part of the Obamacare Affordable Care Act in 2011, they changed that law and it went from 100 to 25%. So that's why you don't hear as many people talking about donut hole. but that's a huge thing. And then above that amount of $65.50, you pay catastrophic coverage, which is 5% co-insurance, and then you see the rest here. So you're on the hook above that amount for 5%. And if you want to enroll in a Part D drug program, you go on mymedicare.gov. That's the portal to sign up for one. If you already have one and you want to change it, like I said, fall enrollment period is the big time. But you'll be knocked out of one plan and be put into another to just give you a sense. So keep in mind that Part D drug program was signed into law in 2006 by President Bush. So a lot of people were on the hook for their cancer medication or dialysis or all these other medications. So this was a huge thing back in 2006 when Part D was put into play. And now we'll switch over to talk to Medicare Advantage plans. And these are the ones that you mostly see advertised on TV. And you get these through a private insurance company, but it does limit you more to local, smaller networks of providers. So 90% of these plans have Part D coverage built into them, so you would not need to go get one on your own. And then most people don't realize that you still need to get Part A and Part B. So even though that Part A premium was free for most people, you'd still have to pay for that Part B to get into this. Plans very similar to what you see now probably in your coverage at work. We have this at John Hancock in our plan. So if you're in the HMO requires you to get a primary care physician. If you want to go see a specialist, you need that referral, and you typically cannot go out of network. So these plans are not good for people who travel. If you travel down to Florida for 5 months, you probably would not want a Medicare Advantage plan, but there's no health questions to get in, which is a good thing. And as I said, part of the reason why people don't like some of these plans is you might need to get prior authorization to get something as far as a doctor visit or some type of medication. The good part is this is a much more affordable way to get your Medicare benefits, and about 39% of people today that are on Medicare are in a Medicare Advantage plan. Now, the PPO plan does allow you some outside network if the doctor agrees to pay the bill or agrees to accept it. But a lot of people like Medicare Advantage because it includes routine dental, vision, and hearing in most cases. So something I didn't tell you, which is Medicare and Medigap do not cover routine hearing, dental, and vision. And that's a big thing that sells the Medicare Advantage plans, is that you get these included in a lot of these plans. And don't ask me why they don't include those in the others. I mean, they weren't put into Medicare originally or Medigap, and that's a big reason why Medicare Advantage becomes an important plan for people. Yes, there'll be lower premiums, as you can see on the bottom, but there's more copays, and it's very similar to some degree to what would be going on with Medicare. So what's happening here is Medicare is paying a private insurance company, let's say $10,000 a year, to administer your healthcare benefits. In essence, what's going on here is Medicare is relying on the insurance company to manage your healthcare benefits. So the insurance companies make a fortune of money by managing your benefits, and that's why you have some of these hurdles that you see. So they're not going to pay for everything, and that's a big reason why people do like Medigap in some situations. So here's what it looks like when you talk about cost. So 60% of these plans have a zero premium, and people love that for obvious reasons. But typically what it might look like is you'll go to the doctor, your primary care, you'll pay $20 for the visit. You go see a specialist, it's $50, $200 a night for a hospital stay. And then God forbid you need an ambulance, it's going to be $300. That's probably where you probably would want to take an Uber to get to the hospital, a lot cheaper. But you'll see here, if you need chemo or oxygen or dialysis, you'll pay up to 20% here, 20% and up, to your out-of-pocket maximum. So that's very similar to how Medicare works. And I think what really sells these plans is the max out-of-pocket for people in Medicare Advantage is $75.50. So this is a much more cost-effective way to get your healthcare benefits, but it does protect the consumer if you do have a major illness like cancer, where your max limit that you're going to pay is $75.50, and then the insurance company is going to pay the rest. So a lot of times people ask the question, are Medicare Advantage plans bad? And I would say no, not necessarily. You just need to realize that if you need any of these here, durable medical equipment, or if you have dialysis or cancer, you may pay up to 20% of these items on many of the plans. Remember, each of these plans are different. So what you're going to pay for an in-hospital stay coverage or outpatient is going to vary by plan. Just keep that in mind. It works a little bit different than Medicare, and that's because they're managing your benefits. Okay, tips for Medicare Advantage, 3 things to know. So we say build a rainy day fund for unexpected costs. So a lot of you who are in a high deductible plan at work right now prior to 65 might be in a health savings account. That's a good place to be, which is also known as an HSA account. The only thing I would warn you there is that as you turn 65, you can, and you file for Medicare, you can no longer contribute to that HSA plan just before your 65th birthday. If you are 68 and you're thinking about retiring from your company now, you need to stop contributing to that HSA plan 6 months in advance post 65. So a lot of people get tripped up with this, and the reason is because Social Security and Medicare work retroactively 6 months back for when you file. So when you turn 65, you can stop basically the day before. Otherwise, you're going to incur a penalty from the IRS because they don't allow you to contribute to the HSA. You can take the money out of that HSA for medical benefits that are qualified. You are allowed to do that. Or if you have a spouse where the plan is in their name, they can still contribute to the HSA because they're not on Medicare. So keep in mind, if you file for Social Security, you're automatically going to be considered that you're in Medicare Part A, which is going to give you that problem in the HSA accounts. So 2, how and when you enroll matters for Medicare. We talked about that, Medicare Advantage. And don't forget to reevaluate the plan each fall. So this is where people also find out the hard way that every year a Medicare Advantage plan can change the benefits. They can also change the price. So every September, those of you who have one currently or you're thinking about it, every September you'll get this annual notice of change. And you definitely want to look over if your doctor is still covered in the network. More importantly, look at the drug formulary. There's so many stories where people walk into the pharmacy in January to get a medication they've been on for a long time that they just got in December. They walk into the pharmacy and find out that that medication is not covered and start freaking out, right? We've all been there at some point where you find out the medication is not covered or it costs you more, and that's where you may have a problem. So keep in mind, to later return to Medicap could be very difficult if you don't like your Medicare Advantage plan. But if you just went into Medicare Advantage and it's the first time for 12 months, you can get back into original Medicare and then get back into a Medigap policy with no health questions. And sometimes people need to do that. So just keep that in mind. All right. So misstep 2 is just really not understanding the routes and the fact that Medicare Advantage does have some similarity to Medicare itself, and that Medigap plans work very different and they do cover more of the benefits. So let's talk about working past 65. This is more towards the final part of this presentation. And thank you again for being so attentive. I know it may be tough to get this on the first shot, but it definitely gives you some things to think about. All right, so how does this work? So for people who work for a big company, meaning larger than 20 people, 20 employees, the group coverage that you have is considered primary. What that means is your company's health plan is going to pay 80% of the benefits, and Medicare is now secondary, and they'll pay 20% of the benefits. So in this case, you can delay your enrollment in Part B and D. You can also delay Part A. What most people do here is they enroll in Part A, because it's free, assuming they don't have an HSA plan, and then they delay Part B and D, as I said, and then take it later. Now, you'll notice in the case of a small employer, it's the opposite. Medicare now is primary, and that's where there's less than 20 employees, and the group plan now is secondary, and they pay 20% of the bill. So a lot of people get in trouble with this, and that's because you work for a small company, you called your friend, and your friend says to you, hey, listen, you don't need to file for Part B or D. I delayed it. It's no problem. You'll file when you retire. Well, they don't realize that the person they're giving the advice to actually works for a company with less than 20 people. So anytime Medicare is primary, where they pay 80%, you must enroll at 65 in Part A and Part B to avoid penalties. So if you don't enroll in Part B when you reach 65 working for a small company, the penalty is 10% per year. So if you didn't enroll for 2 years and then all of a sudden in the third year you realize, oh, you should have, you're going to pay a 20% penalty in the premium for the rest of your life. And that's where you really want to pay attention to this. And this is probably one of the more important things to know. When you retire from a large company, there are a couple of paperwork forms that you're going to need in order to file for B. And one of them is going to be that your firm can provide proof that you have coverage, you've had credible coverage since you started working there. And there's a couple of forms there, but just something to know that your firm will need to file a form. They'll have to sign it. And obviously you can get in touch with somebody at Egan Berger and Weiner and they can explain that in a little bit more detail, or somebody you're talking to about Medicare. All right, a number of you locally work and have federal employee health benefits. We get a lot of questions on this. So here are your choices. Enroll in Part A and FEHB. You'll pay copays and services as you go, very similar to Medicare. But the thing is, if you later decide that you want Part B, which is this outpatient part, if you later enroll, you will pay a penalty for not getting Part B at 65. Because FEHB is not considered credible coverage. And when something's not considered credible coverage, you must have Part A or B, otherwise you will pay a penalty. What a lot of people do is they enroll in Part A and Part B, and that way most of everything is covered in the services, so you have little to no copays. And then some people suspend FEHB and choose a Medicare Advantage plan. So keep in mind, you don't want to cancel FEHB because if you cancel it, you can't get back in. So most people suspend it and then you get A, B, and D all from the Medicare Advantage plan. And then lastly, you don't need to file for a Medicare Part D plan when you're in FEHB because the coverage is considered credible when it comes to the drug coverage. So that's how this all works. A lot of people want to know whether you should take B or not. Obviously, it depends on your situation, but you want to make sure you want to avoid those penalties. All right, misstep number 3, enrolling too late. That's usually what happens. And my comment about small employer coverage. In that case, Medicare is always going to be primary where they pay 80%. And then people will have retiree coverage. Some companies like Verizon, I believe, offer retiree coverage. When you have that, you do need to file for Part A and B. More than likely, you may have credible coverage there for D, so you may not need it for retiree coverage, but that gives you a sense as well. Obamacare plans, a lot of people that are on them pre-65. Once you turn 65, you need to file for Medicare because it's not considered credible coverage, so you need Part A and Part B. If you don't, you'll have penalties, and if you were getting a tax break on the Obamacare plan, you wouldn't see that tax break after 65 and the IRS may penalize you. All right, so this is the last part. I just spit the water from the fire hose, so I apologize, but this will give you a quick review of what you want to know and what we talked about. So parts of Medicare. You get the first 2 parts through Social Security and the website. It takes about 10 to 15 minutes there to sign up. Even if you're only signing up for Part A, you still want to go to that website. And that's what's known as original Medicare, Part A and B. A being your hospital coverage, B being your outpatient coverage. And then the other parts, C and D, you would get through a private insurance carrier. In the case of Medicare Advantage, that's Part C, which is at A, B, and D, and that acts like your travel agency where you get it all from one place, the flight, the hotel, and the car. And then if you need a standalone drug Part D plan, you get that also through the private insurance company. So here's a review of the routes. So let's assume you get original Medicare, A and B, and you don't want to get a supplement plan. You think, hey, I'm relatively healthy, I don't need it. No supplement, there'll be no cap on the spending, as I mentioned on the Part B of the 20%. The route that a lot of people want to go is you get A and B, you get that standalone Medigap plan, you get that standalone Part D drug formulary plan, and then there's little out-of-pocket expenses. The premiums are higher, as I mentioned to you, but not too bad. But you don't have doctor networks either. In the case of Medicare Advantage, lower premiums, maybe a zero premium plan, but as I said, like Medicare, there's more cost sharing, and it does limit you to the doctors that are in your network. Not necessarily a bad thing to do. It's a lot more cost effective than Medigap. All right, last thing. Working past 65, just a quick review. If your company has less than 20 employees, you can delay Medicare Part B and D and A if you want. No penalty for delaying. And if you have less, as I mentioned, you're going to need to get Part A, B, and D because Medicare is primary. And as I said, you would incur penalties if you don't. So what are the next steps? Well, number one, the Centers of Medicare and Medicaid are, here's your website, medicare.gov. I did not talk a lot about Medicaid, and the reason is because that's a federal and state program. It is typically for people who can't afford to pay their premiums on Part B or D, or they need help with some of the cost sharing that is out there for those of you who want to know, and it's typically for people with less income. But that's important to know that it's there as a safety net for you. The Social Security website is really where you're going to be finding everything, the forms, how to file, and when to file. That's all on SSA.gov as well, as Medicare and Social Security work together. I do recommend working with an insurance agent, and the reason why I do is most financial advisors do not sell Medicare. It is not necessarily their forte, and this is where I do recommend looking at somebody who specializes, who's a Medicare broker. The people that wrote this presentation for us is a name by the name of Boomer Benefits. Boomer Benefits is a company in Texas. They have over 50 people working there, and I have not found anybody on Medicare nationally who can handle every state. So I do like them. They did put this presentation together. There's a lot of great videos on YouTube. They're not paying us to refer them, but for those of you who just want to find out more about Medicare, there's a lot of great videos on Boomer Benefits on YouTube if you want to do a little bit more research. Now, under 65, some of you might need to go on healthcare.gov. That's the marketplace or the healthcare exchange. That's where you would get a plan that's affordable possibly to your income. And that's really what Obamacare is, that under 65 health plan. So I'll stop there and take some questions if anybody has. I'll thank you for listening attentively. I'm sorry I didn't have more humor in this presentation, but as you know, there's a lot to cover here and it's very detailed. So I appreciate you being attentive and for being on this call today. Howard, I'll pass it back if there's any questions that are in the chat.
Howard had to go into a meeting, so this is Carmen Wook speaking right now. So Danny, thank you so much for your presentation. And I know we have many questions, but we do want to be respectful of all our clients. We will make sure that the questions that are here for us, we'll make sure that they get addressed and emailed to you. So we'll give you the answers. Thank you for participating in this webinar, and we look forward to our third webinar coming the latter part of this year, or the third quarter of this year. So look forward to some emails announcing the next topic. Danny, again, thank you so much for your time, and we'll talk to you soon.
Thank you very much, everyone. Have a great day.